much for joining the Virtual Blockchain Summit. We're so happy that you are here. I am Talisha Shine. I'm an inner circle member of the Black Blockchain Consultants and also VP of Blockchain Consortium International. And with me today to discuss blockchain in healthcare, we have Nafisia Morisseau and also Dr. Alfonso Sexton. So I will have them both introduce themselves and we will get the discussion started. Nafisia.
All right, Talisha, thank you. My name is Nafisia Morisseau. I am a nurse practitioner and I've only practiced emergency medicine, and I've been in the healthcare field for about 15 years now and about 8 years as a in a clinical setting. And I love blockchain. I'm also an inner circle member of the Black Blockchain Consultants, and we are also members of other clubs, right, Talisha?
Yes, very much so.
All right, so pass it on to Dr. Alonso.
Yeah, hi, thanks. Thanks for having me. My name is Alonso Sexton, and I am a orthopedic surgeon. I specialize in sports medicine. I've been in clinical practice for about 12 years, but I have a passion for blockchain. I work and function as an ambassador for a company called Patientory that is looking to bring blockchain into the healthcare space, and I'm excited to have the discussion today.
We are very happy to have you here. So as you discussed that you are a clinical practitioner, so what led you to blockchain of all things?
Well, it's interesting. So for me, my path, my journey, if you will, about 4 years ago, we had in my practice a data breach where through a third party, hackers actually got access to over 400,000 medical records.
Wow.
And an organization called the Dark Overlords, which sounds like a joke, but is not one. And through a third party, they were able to get access and then sort of hold us ransom essentially for those records. Mm-hmm. And as we went through that process, I started to really get interested in cybersecurity and how that works in the healthcare realm, and started learning a lot of disturbing facts, such as healthcare information is about 6 times as valuable as standard financial information, because of the amount of information that's actually contained within those records, and the security around those systems are not anywhere close to the sophistication of those other types of organizations. And so I came upon blockchain at that time as a decentralized system of control and of for data management, but in Bitcoin and cryptocurrencies. But that started my interest, and probably I sort of haven't come up for air since I started reading and learning about it. It's been sort of fascinating.
Kind of like a rabbit hole. You get into one part and just can't get out.
Yeah. Exactly.
So what do you believe that blockchain, how will it transform healthcare in your opinion?
Well, I think you have to look at what are the trends in healthcare, where is healthcare going? And I think the 2 things, in my opinion, that are the most obvious, one is consolidation, large systems coming together, practices coming together, insurance companies coming together.
Mm-hmm.
And the other is the transition to value-based care. So transitioning from a model where as a provider or a system, we're paid per visit or per surgery, really looking more at where the value is actually provided to patients, and having systems that provide more value getting reimbursed more. And if you think about the formula for what value is, it's a combination of its outcomes over cost. So the highest value product is one that has the best outcomes at the lowest cost. And when you start looking at outcomes, you then have to say, well, okay, well, how are we defining that? And in order to actually make that definition, it requires collaboration and creation of standards that can help to determine, well, if someone has surgery, what's actually a high outcome that's going to give the most value and be the one that's going to be reimbursed at a higher level. And that's where I think, sort of you can imagine on the consolidation side, where having a system that allows for collaboration between parties that don't have trust between one another is valuable. But also on that outcomes and value-based side, I think there's a tremendous opportunity for blockchain systems, or at least the concept behind open blockchains to play a big role in healthcare and the trends that are going on right now.
And you say collaboration, and that's a really good point with regard to having so much data. That's the issue with healthcare in itself, is that the amount of data is hard to literally correlate all that information because it's in siloed systems. So you have EHR systems that don't talk to the pharmacy, that don't talk to the specialist information systems. So with that, what do you believe will it take for all of these parties to kind of come together and really adopt blockchain as a system to really help this collaboration as we move forward?
Well, it's a good question. I mean, I think the short answer is I don't know. But I will say, I think in my opinion, that there's two approaches how this can go. One is more of a bottom-up approach where you start at sort of the grassroots level, if you will, with, whether it's at the patient level or provider level and building the system up from there, or from the health system down. And one of the difficulties, I think, is that in dealing with larger systems is that they have significant amount of legacy systems that they've invested a significant amount of resources towards, and a disruptive type of technology like blockchain, I think, will be a difficult sell in those environments. And my prediction, if you will, is that most of these adoptions will probably not occur in the U.S. Quite frankly, I think that this is probably a phenomena, at least in healthcare, that will be led from outside companies. A lot of the research and the conferences, if you look at where those are being held, you see a lot of them being done in UAE and in Europe and in other countries that maybe don't have as much investment in infrastructure at this point. And so I think that those are places where the adoption may be more needed, and there's more of an opportunity perhaps for those countries or those areas to leapfrog some of the legacy systems that we've been dependent on for here in the U.S.
So talking about legacy system, so since I'm kind of like more into emergency medicine, so we have, and I know you're an orthopedic surgeon, so I'm going to go towards ortho. So a lot of times we have patients, okay, they fell, they came from a different hospital. Oh, I fell, and they told me I need to see an ortho or an orthopedic surgeon, and I broke my leg or whatever, whatever the case may be. And we only go by the story. We don't have any images, nothing else. So we have to repeat everything that they had already started at the other hospital that may be about a mile or two away. So I know
yeah, that's a big problem. I mean,
yes. So as an orthopedic surgeon, I know for us in the emergency medicine standpoint, blockchain will it will save us a lot of time and money and a lot of resources. So on your standpoint, on your side, how do you see that improving your specialty?
Well, yeah, it's a big problem with the siloed data, and I can tell you almost on a daily basis, I'll have a patient that comes in with that exact scenario, and one of the problems and frustrations I think with patients, which again may lead to more of this bottom-up approach, is that system that you just described does not match patient expectations. I mean, the patient expects that and again in my system, this may even be within the same system. The hospital ER to a hospital or to an outpatient visit, it still has this disjointed relationship. And patients expect that, well, it was done in your system, why don't you have the records? And it creates this major friction point and an opportunity, again, if you can create a system where, and again, ideally, it would be that the system really doesn't control the information. And that's what Patient Tour is sort of interested in, is actually creating a system where the patients themselves are the shepherds of that data and that information. And so they are no longer required to have the emergency room actually send files or have the two systems be able to communicate. You basically create a system that that allows for that easy flow of data with the person that it's most valuable to, which is the patient. And I think that, again, the blockchain concept is something that has really been exciting for me, because I do see it as an opportunity to help with that, the frustration and the inefficiency that's in the system. So I absolutely agree with you. That's a big problem and something that this could potentially provide a solution to.
That's a great example. And again, we're talking about different areas. We're talking the, outpatient visits versus an ER visit. And in your opinion, again, what do you think are the areas in which we can see the most traffic, with regard to the adoption of it? Because we have this amazing diaspora of, entities that we can kind of touch. Where do you think blockchain could fit right now, more like a plug and play rather than being an overhaul of the entire system?
Yeah, no, I think that's a great point, because it is really, there is a need for early wins with this type of technology, where you need to get people to really appreciate where the value lies. And for me, I think the holy grail would be the medical records, but I do think there's some opportunities for sort of low-hanging fruit. Ones that I see, for example, include credentialing, which is a known friction point for everyone, for hospitals, for doctors, for anyone who's involved in that process. They know how frustrating it is. The same way patients have to provide information at multiple points, physicians have to do the same thing in the credentialing world. And so that's an opportunity, I think, relatively easy. There's no sensitive information that you're necessarily dealing with when in regards to patient information. So I think that's one, and there are several companies that are working on that. I think something as simple as, in my world, preference cards. So as a surgeon, as you go through different facilities, you have particular equipment or preferences that you might have that you need to share with the staff in order to make sure that they have all the equipment that you need in order to successfully do a surgery. And in a similar way, there is this disjointed system where one facility may have one set of information, but that communication doesn't have the ability to transfer. And so if you had a system where that's provided by the person that provides most value to, which in this case would be the surgeon, then that could plug and play, and they could, at one facility, I could provide the information just like I could to another facility. So I think what I look for are situations where you have this obvious and known frictions that in the past people would just say, well, that's just the way it is, and there's really not much, it's just a system. And so with blockchain technology and the ability to create trusted platform where people can trust and say, hey, I know that this information is valid, and allow it to be shared in a way that is easy and convenient. I think those are the types of systems that I think about as easy wins, if you will.
You also talked about being an ambassador to Patientory. If you can give our audience just a little bit of information with regard to what Patientory is and how they operate.
Well, yeah, it's this organization. The founder and CEO, Chris McFarlane, really had this passion for healthcare and for, again, solving some of these solutions that we've talked about. And where they really sit as an interoperability exchange, or as an interoperability platform. And again, the goals of which are to provide this ability for data flow freely between these systems that, again, have no reason to trust one another. And it was the first healthcare token, so that that sort of went through an ICO, and they raised a good amount of money on it. But again, it just showed that, and they're showing that this concept is something that has a lot of promise in the future. So I'm excited to work with them, trying to bring it to fruition.
That's great. I've been following Patientory from the very beginning, and always so excited. I worked many years with EHR systems, so that was really exciting to just see the concept and watch it grow from just the idea to actually coming to fruition. So it was really exciting. So I look forward to seeing what comes next with regard to that.
And I'm pretty sure the providers will also appreciate the fact that we will have an EHR that will be compatible and almost solving the entire interoperability problem that's going on right now, not only in the blockchain but in the whole EHR, different EHR systems, right? That we have the problem. That's a major problem.
And
it's interesting in healthcare, we have this somewhat of a split personality in regards to technology, because from a clinical standpoint, we're very do robotic surgery. We're sort of always creating new advances in surgical techniques and care for patients, using new medications. But when you look on the other side of the sort of business operations, and specifically the health IT world, it's very antiquated. And, that's part, I think, a lot of the frustration is, for providers that are interested in this type of thing is that, we sort of have, there's a lot of us who have sort of this technological slant, but then you sort of run up against sort of these barriers once you try to get into the health IT world. Some of that's related, again, to the sensitivity of the information, some of it to, HIPAA laws, and, sort of no real platform to allow for true, significant collaboration. And so I think that's one of the challenges that, implementation is going to face. And then the other thing I think is that providers, as providers, we classically, there is somewhat of a love-hate relationship with the technology, because a lot of times, you'll have people come in that, are EHR specialists, or there's the new fancy technology that's going to make your life, so much better. And in most cases, most of those technologies have simply just added to workflow frustrations and include the work that, physicians do. And a lot of that, I think, does have to do with the top-down approach. A lot of the times those initiatives are sort of mandated from above, whether it's the administration of a hospital or an insurance company. And those are the things that I think another barrier, I think, for implementation is sort of getting providers that are sort of boots on the ground, sort of to want to appreciate the value, sort of hear the narrative of how it's going to help patients, and then have that promise fulfilled with actual technology.
Do you think that actually contributed to the fact that the healthcare community is not really embracing the blockchain that well? Is that, as far as like information technology, changing systems all the time, and they have to learn something new all the time, and most of the time, they think it doesn't work, it doesn't make life easier than they thought it would?
Well, I think that plays a role in the introduction of really any new technology in healthcare. But I think blockchain is something that's so different and so difficult to understand that I think that that's something maybe a little different that's going on in blockchain. Because, I think you talk to the average person, physician, attorney, politician. I mean, I think most people sort of have an understanding for really what it is. I mean, maybe they've heard of Bitcoin, maybe they, sort of know what the price of Bitcoin is, or, they've heard of Ethereum maybe, but for the understanding the fundamentals of what it really is. And for me, it took me years of like studying it and researching and reading about it to really understand that what it does is it's a way to create trust in a way that doesn't require a central authority, which is, I mean, that's a very, powerful and, powerful technology. And, to the point, like when I talk to people about it, I use the term, it's an inconspicuous technology. And what I mean by that is like trust at scale is a technology that we don't really appreciate as a technology. Because if you think about, how trust has evolved through the millennia, initially people trusted. How do you know who to trust? You trust people and that worked for a while, but there's sort of a limit to how big of an organization or society you could create with that. Once you get to a certain number, then we created as a society these sort of centralized trust models, which would be governments, which would be religions, which would be banks. And what blockchain really at its core allows us to do is it allows us to have trust at scale, but also to have it in a way that doesn't have this sort of central authority that's corruptible and, and doesn't allow for value creation and creates these sort of inequalities. And so that's the part for me, I guess my aha moment was like, when I really understood that, you say, okay, well, geez, yeah, it's not just medicine. There are other sort of opportunities for utilizing this technology. So yeah, it's just, it's just fascinating. Sort of going forever talking about it, but it's in healthcare, it's just this thing that I think healthcare sorely needs, because there are a lot of problems with the way the system works.
We talk about this a lot with regard to just the pain points. And again, we know the system is broken, and blockchain is not a silver bullet. It's not going to change everything overnight. And I think that's what people want it to be. And I love that you said it was inconspicuous, because I always say it's the plumbing more so than anything, because it's going on. You're still going to use those interfaces that we have. So the EHRs are not going anywhere. We're not trying to replace them. who are just trying to replace their back end systems to much more effectively and efficiently hold and handle that data. So I love that part. So if you could kind of make a blockchain that would be optimized for healthcare, what would that look like? Oops, did I lose him? Can you hear me? Nafisa, can you hear me?
Yes, I can hear you, but
Oh,
I think Dr. Caruso can hear you.
Did he drop?
Yes, seems like it. So while waiting for him to come back, okay, here we go. All right.
Hello?
So
Yes,
I lost you there.
that's okay. Can you hear us now?
Yes, I'm back. I got you back. Sorry.
Okay.
Yeah, I lost you on your last question.
Okay.
There. Sorry.
I said if you could actually construct a blockchain that you believe would be optimized for healthcare, what would that look like?
Well, yeah, to me, you know, when I think about blockchain, when I think about Bitcoin, again, I'm sort of, you know, I think it started from a need. You know, people had a need, you know, so we talk about Bitcoin. Bitcoin is the first blockchain. There was a need in
okay. I think we
Losing him.
as that provider, you know, it's been a sort of we documented on the reimbursement at a time where the real value will actually be in the actual data that we're generating with patients. And so, you know, I imagine a system where patients have control over their data and their information, their health information, which we again know is very valuable information to a lot of different parties, where, you know, as a provider, yeah, you know, obviously our goal is to take care of the patients and, you know, sort of help them with the issue that they came in with or be preventative. But the reimbursement model will change to the point where it's not really about, you know, billing and insurance code. It's about actually interacting with the patient in a valuable way that they get value, such that then they can create additional information that then they, the patient, meaning the patient, can utilize in a way using potentially a blockchain that allows them to create value for themselves, meaning that that information they can share with whoever or wherever it provides them the most value. When they're sick, maybe that value is is highest with their physician. But in times when they are not sick, perhaps most of that value comes from sharing that information with a researcher or an advertiser or a government agency, such that they can pick and choose where that value is most from. And you know, similar, you know, people always talk about Uberization, but you know, the sort of interesting thing about that concept of Uber is that it allowed people to make use of their own personal property in a way that provided them the most value. So, you know, if they wanted to drive their car and make money from it, they could do that. But similarly, with the information data that they're generating through healthcare, I mean, that information can be very valuable to a pharmaceutical company that's trying to develop new drugs for a disease that they have. And so, you know, that's a complete paradigm shift from what we do now. And I had someone ask me one time, as a physician or provider, and they asked me, well, you know, sounds great to have this system where, you know, the patients, you know, they control everything, but who's responsible for it? And then how do I have time to do that? How do I have time to actually sort of interact in that way with the patient? And, you know, the answer, I think, is that, you know, if you change you know, the reason why physicians, I think, are burnout and you have these high rates of frustration in physicians is that the requirements for insurance and, you know, for governmental, you know, reimbursements has got to the point where it is a lot of just redundant, you know, inefficient information collecting, you know, data managers as opposed to actually being physicians. And if you can sort of change the onus of that data collection from being within the health system and actually give that responsibility or that right to patients, I think that creates a system that decreases inefficiency, but also allows for creation of markets and economic incentives that can be help to lower costs in healthcare and also create, bigger pies for everyone, if you will.
That's great. I definitely agree. I think, the empowerment of the individual for their own data is very important, and we haven't seen that. I think we've seen the lack of control, and we always feel as patients that we're just kind of giving everything away and have absolutely no idea what's happening, and then you feel disenfranchised by your own information. So the aspect of giving someone back their power over their own information as well as their health, I think that would also kind of change the onus, as you say, and make a person responsible for their own health care, as well as now a partner to a physician rather than just a patient.
Well, now, and the other thing I would add is that, and that sounds great, and I said it, and you said it, but there are some real problems with that. There are some real, there's a significant responsibility that goes along with that. And one of the things that I think is really, important why for people to sort of understand and go through the Bitcoin part is that tying that amount of responsibility to money is very powerful. Whereas, if you tie that responsibility to medical records, I don't know that people have that same, feeling of how valuable and important it is. And so I think that's partly why you have to have a Bitcoin first, where it's actually tied to a currency that people, so if again, not having anyone that's in control means in the Bitcoin world, if you lose your Bitcoin, it's lost, it's gone forever. And so what does that look like in the context of medical records or medical data? Because it's that safety net, if you will, that's usually provided by a centralized organization that you do give up if you have a system that the patient is in total control. And so, again, people very quickly learn in the Bitcoin world, well, what do I need to do to secure this? And again, it is very empowering to sort of know that I have full control, but I have full control of me, but it's also sort of scary as well.
That is. So again, this is where we kind of bolster the good aspects of it against some of the things that would be detractors for most people, like what happens if I don't remember my medical records, or what happens when I need something and it's not readily available to me. And patients having dementia or older individuals who are not really responsible for their information at this point, and then having to transition to that as well. So there are definitely some things that we have to consider, but as a whole, again, this is where blockchain is not an overall solution. We're still having, I think, a stair-step approach to its implementation and also its evolution. And that's why we kind of call ourselves advocates for it rather than evangelists, because evangelists believe that it's just everything, it's a cure-all, and we understand that we have to take the good with the bad. So we do appreciate that comment as well. Our final question for you, well, my final question, Ms. Nafisia may have something for you. What other projects are you working on with regard to blockchain and healthcare?
Well, as I mentioned, I do sports medicine, and one of the things that I focus on, I'm very passionate about, is talking to patients about the physical activity level. And, when you hear the term sports medicine, it's a little bit of a vague term, but, really what it means is that, I always describe it as I help people get back something they've lost. So, everyone has lost something, and you know what that feels like. And if you ever found that thing that you're looking for, you also know what that feels like. And that's what I help people do. So, people will come in, they can't play a sport they love, or they can't work, or they can't go on a trip they want to because they have a bad knee. Help people sort that back, and it's part of empowering people, the power of exercise and physical activity. And so, and chain is best when you goals and something I'm excited about is
I think we completely lose
company and essentially allow patients to monitor their physical in a that that information ability to create.
Oh, we lost him.
I think he'll come back on.
Okay.
But
Do you have any final questions for him?
I actually wanted to know, before blockchain, before getting involved into all that, did he have any other technical skills, or what kind of like led him more into the the technology world was like blockchain? Because it seems like blockchain is bringing a lot of people over.
Yes, it is. It just, you get, that little bite, and then you get, get a little taste and see what happens.
About the benefits and, okay, here we go.
We got a few more minutes, so we're making great time.
Perfect.
Yeah, she'll have to edit a bit of this, but we'll make sure.
Hi, Dr. Sexton, are you here?
But yeah,
We can't hear you if you're speaking to us.
You're still breaking up. I think he'll come back on. So I like the fact that we have so many people working on the EHRs because it's a major problem. It's just like I said before, it's like a broken glass, and you just have pieces all over the place.
And I love that analogy. That right there is such a powerful analogy for the system itself, for healthcare. It's shattered and fragmented in so many ways, and you can kind of put the picture together, but it's not. There you go.
Yeah, hey, sorry.
That's quite all right.
Time is up, huh?
We're almost done. Ms. Nafisa, final question for you.
Actually, I wanted to know, before blockchain, did you have like any other technical, were you in the technology world before, or just, kind of like tasted blockchain a little bit and, that kind of like brought you over? Because it seems like that's happening to a lot of us.
I've always had a technological slant. I mean, things that I've been interested in, internet stuff. I went to school out in Silicon Valley, like during the 90s, and so that was sort of what I was doing at the time. But yeah, I definitely think this is more wide-reaching. So that's been the thing that's been exciting for me. We did some stuff with EHRs and telemedicine stuff early on, but nothing as formal as this. And the fun part has been that it really is, if you're learning about blockchain, you spend some time, you can become someone who knows as much about it as anybody in the world, in a pretty short order. Very hard to understand and complicated, but it's so new, and I think people that are working on it are sort of really on the cutting edge. So I think that's the exciting part for me.
Great.
Thank you very much. We appreciate you and your time, and it's just been wonderful speaking with you with regard to this. We could talk about this all day, so it's not like we could grill you and just go back and forth. But again, thank you very much, and thank all of you for joining us on this, and hopefully you enjoy the rest of the conference. Have a great day.
Thank you.